I hope you enjoyed the break and that you are ready for the next session here at Nordic Welfare Forum. Stronger Together, why developing Nordic welfare indicators benefits all. I will hand over the screen and the role as moderator to Kristoffer Lundberg in Sweden. I will just sit back and enjoy the following session. Please, Kristoffer, the next hour is yours.
Paljon kiitoksia, Jens. Thank you very much, everyone, and a warm welcome to this session. My name is Kristoffer Lundberg, and I'm a Deputy Director at the Ministry of Health and Social Affairs here in Sweden. I am also the Chair of the Indicator Subgroup of the Social Protection Committee of the European Union. And it is in sort of both capacities that I've been asked to moderate this session. And together with me today, I have a very distinguished number of panelists. It is my old colleague, Tom Nilstjärna, who is a senior advisor within the Ministry of Health and Social Affairs. Tom will discuss on the topic if timely welfare indicators are possible, and he will also extend his discussion on the Novi indicators. Very exciting. And then also together with us today, we have Ulla Agerskov, who is a senior advisor at the Nordic Council of Ministers. And she will discuss on how to develop Nordic indicators. So a warm welcome to Ulla as well. And then finally, we have with us Mats Stjernberg, who is a senior research fellow at Nordregio. And Mats will discuss indicators to follow up on active and healthy aging. So a warm welcome to all of the presenters. We will have the following ways of procedure. I will begin with my own presentation. Each presentation will be roughly about 10 minutes or so. After this, we will have a couple of questions, and that's pretty much it for this intense 1 hour. So I look very much forward to it. So without any further ado, I will now try to present my own presentation. Please bear with me, as the gods of technology are not always with us. Let's see here. Can you see the presentation?
Not yet.
What about now?
No, not yet.
Okay. Ladies and gentlemen, let's hope that this works out well. Well, this is always the challenge, as we are all well aware that the technology might not always be with us.
If Kristoffer, our technician Heli, has your presentation, she can also present it, and you just tell her to move forward if Heli has it.
No, she doesn't. That's the problem.
Yeah, okay.
It should be simple. Okay, maybe we can do as the following. Is Tom Nilstjärna ready to do his presentation? And I will try to come back to this after Tom. Tom, is that possible for you?
Okay. I can do that.
Yeah, so I will now leave over the word to Tom whilst we deal with this technical.
I'll try to share my screen here, and I show my presentation now. Hopefully you see it. Do you?
Yes, we do.
Yes. So this is the what I will try to talk about today. Are timely welfare indicators possible?
Sorry, your presentation isn't in a presentation mode.
Presentation mode. Let's see where we can get that. This one. No.
No.
I mean,
that one, I think, yes.
Yes.
No, yes.
Perfect.
Thank you. What happened now? This is not working. I had it working for a few seconds, but now it's out again.
I can share it from here if you want.
Who is talking?
Heli from NetVideo.
Okay, you can show it.
Okay.
So you just tell Heli to
yes,
to
I will tell her
slide.
when to shift. So are we out now? Are we broadcasting?
Yes.
Yes, good. Thank you. So what I will try to talk about today is the project of NOVI indicators, the Nordic Welfare Indicators in English, or Nordiska Välfärdsindikatorer, which is the Scandinavian name. We have been doing within the change, please. Within the you can change picture now, please. Back to no, not that one. Thank you. Within the Nordic cooperation, there is the two committees, NOMESCO and NOSOSCO, that deal with welfare data on health and social issues. And we have been working very many years on the basic data gathering and the comparability between the Nordic countries. And a decade now, there has been work going on creating a Nordic welfare indicator system. This was inspired by the Icelandic work that was done during the financial crisis. This is a very broad and very challenging project, since the aim is to use timely data, as it is called in the English languages, monthly or quarterly data to be used to follow and to compare social and health outcomes. Please, next. I will only be able to do parts. I cannot talk about the whole project today. It's a very broad and demanding project, but I will try to come into one part that is about incomes. And certainly I will end the presentation with the example from Sweden on the development during the pandemic from a Swedish database, as I said. Please, next. Next picture, please. Yes. I mean, the nature of a crisis, if you want to follow it and if you want to do policy during it, is that there is a genesis of it from many possible. The genesis can be of different character: financial, pandemic, climatic, terror, and so on and so on. So we what we want to do is to prepare for many different aspects of changes in that impacts the welfare. We know that it can be fast moving. We have seen that during the pandemic, and we also need an instant responses from the policy making level, and we want to know who to protect and what parts of society we want to protect when we do monitoring. Please, next. There are several dimensions of welfare, but what we have within the group that is working with this project try to say that we want to look at incomes, we want to look at health, and we want to look at well-being in a more general sense. And when we talk about well-being, it's very much a question of maybe trying to find indicators on subjective well-being when people measure their own well-being on enquetes and questions that they answer. Please, next. So there is a wide variety of possible aspects of welfare development that we want to follow. I mean, labor incomes change, transfers change, taxes might change, mortality, morbidity, disposable income, subjective well-being, and so on. Next, please. Here is an example of the weekly deathly weeks. The deaths during weeks for 70 plus persons in Sweden during the pandemic. And you can see that the black figure from week 10 until week, say, 25 was very much higher during 2020 than during the year before 2019 and the year after 2021. That is just one crisis measure, so to speak. Next. And when it comes to incomes, the welfare sector has a role to play when it comes to determining the gross disposable income. There is the labor income, and there are, of course, the transfers. These ensemble means that you will add up to a gross disposable income. I mean, the welfare sector, some talk about automatic stabilizers, and that is true, but there is also the need for the transfers probably to be adjusted, the rules for the transfers to be adjusted during a crisis to be able to fill gaps that might happen during a crisis. Next, please. So, in order to have an instrument, a mechanism to follow and to probably help policy during or close to a crisis of some sort, you need timely data. And this is mainly what the project that we are running in Nordic Welfare now is about. Please, next. Yeah, you know these figures probably. What we have done is to first look at how and if we can find data on GDP, as an example, in the Nordic countries. And we can, of course. And we see the dip in both in Finland and in Sweden. And we also see changes. Those are quarterly data, and there are monthly data in Norway. And one problem with the short or with timely data is, of course, the seasonal adjustments or the seasonal aspects of data that we have. So we are comparing 1 year before in order to get the curvature more correctly, in order to take away the seasonal adjustments that are there. Please, next. And here is employment, and we can see that from 3 countries again: Iceland, Norway, and Sweden. And when we have unemployment effects that there are two dips down. First, during the first quarters of 2020, and then a bit later the same year and coming into the 2021. Next, please. And we also have a quick look at social assistance in different countries. And one of my surprises has been that we have not had a rise in social assistance in Sweden during the crisis. And there is a discussion going on whether this is an effect of policy, or if other aspects come into it. We cannot answer that fully now, but it seems to be a more concentrated social assistance picture today than before, so that fewer people get more, it seems, instead than earlier. And this is both behavioral, probably, but also policy related. Next. My more theoretical idea is simply to say that we have a gross domestic production that dips during a crisis. We will probably also have a gross disposable income that dips, and even more labor income dips during the crisis. So what we want to follow and maybe make policy around is to see if the welfare state, the transfer system, can stabilize, so to speak, the income of the incomes during or close to a crisis. So please, next. I just want to say that the country that I know best is, of course, Sweden, and there has been developed the last few years a database that makes it possible, at least approximately, to build a system that shows both gross domestic income and labor income and how these work together. Next, please. And these are the transfers during the crisis. We start with 2020, the first month, and we move to March this year. And there is unemployment benefits, disability pension, sick leave, activation payment, that is also work unemployment related. There is parental leave payment, social assistance, activity payment, study support. And these add together, we say, the transfers that people can get Please, next. And this is the index. We start with 100 index during the first month of 2020. And as you can see, during the crisis and onwards, unemployment benefits and activation indexes have risen substantially. And this is both a volume effect, but also rules effects. So policy has a play here. It's not just an automatic system. It's made from policy, more liberal rules during the crisis. Next, please. And this is quite challenging. I understand showing this, but what we want to do and what we aim to further develop is using this kind of database to show for different groups how they fare during a crisis. We look at different groups. I have shown 6 groups here, starting with the all grown-ups, close to 8 million grown-ups, and ending with well, I cannot see the whole picture because there is a lot of things in the way here. But the last group is a smaller group of immigrants where we check how they fare during the crisis. So what it says is that the black upward line is the gross disposable income, and the red one is the labor income. So you see how these have changed during the months of the crisis. And then there is the index, and the lower bar is the composition of labor and transfer incomes, how they develop during over time. This is certainly not conclusive in any way, but what you can see is that the crisis has, at least for the most rightward immigrant group, shows that the red line is dipping more than the black line during the crisis. And this shows that there is compensation for this group when it comes to incomes, gross incomes, when labor incomes dip. This can be developed, and we can follow many more groups with cross-sectional data. And there is also a possibility, and we haven't done that yet, but we will, to follow people longitudinally. So we follow persons during the crisis. So it's not just a cross-sectional, because here there is shifts in the composition of the group during the time. So the main things about this kind of analysis is to try to pinpoint the welfare system effect when labor incomes are hit during a crisis, and to do it as early as possible so that that policy can come in and correct in a way. Next, please. There are some conclusions that you can draw from what we have done so far. We have just worked not a whole year yet on this, but we know that monthly income data can be used for welfare analysis close to real time. I think it's obvious. We need to more concentrate on building these data so they can be used for this purpose, but also for other statistical uses. I mean, monthly data, quarterly data are becoming all the more used in different settings. There is also need for development of quantitative measures of other dimensions of welfare. I mean, we were talking about health, we were talking about well-being, and we haven't come as very far on that yet, but we want to quantify that. That's the bottom line here, the quantification approach. So more outcomes needed, and what we also want with a system like this is that it should be possible to simulate policies. So we don't just need data, we also need analytical tools for doing analysis on this. And of course, a guiding technical frame is needed for users of this. Please, the next one, which is the last one. I mean that it is possible to use timely monthly quarter data for welfare analysis, but there are some high mountains to climb to get there. So we expect to be working on this for at least a few years to come. This was very fast. So sorry for this, but this is how it is. Thank you.
Thank you very much, Tom. This is very, very, very fascinating indeed. Let's just move on to my presentation very quickly. So my
yes, I will get off this one.
Okay, thanks.
So, yeah, go on.
I think you can mute yourself as well. But
I will do that.
So how will EU social indicators and Nordic indicators, how can they complement each other, and also discuss some possible avenues forward? That's my presentation. Next slide, please. So a little background. The 5 Nordic countries, Åland, Grönland, and the Faroe Islands, have very much in common. This is obvious to all of us here. We have roughly about 28 million inhabitants. It's the 49th biggest, largestly populated area in the world. And it's also one of the richest and one of the biggest economic areas. Our common GDP put together is number 19th. So this is something that I always want to sort of emphasize in these forums, that together we are actually quite a big deal. Furthermore, when it comes to social policies, our societies are built around strong welfare states and a strong welfare model where we have a social contract with public institutions that enjoy a high level of trust among citizens. Next slide, please. However, we do have, as in with all friends and family, various affiliations, and here are a couple of them. So if we take all the 5 countries, we all belong to the Council of Europe and the Nordic Council, obviously, but some of us belong to the European Union, some does not, but we all are members of the OECD and the United Nations, for an example. So there is a little bit of heterogeneity here. Next slide, please. So if we then turn into the EU, within the EU, we have a social protection committee. And underneath this social protection committee, there is an indicators subgroup. And this group was set up in 2001 in order to develop and define common EU social indicators. And the reason for this was that we needed better comparisons amongst the member states in the EU in order to measure our commonly agreed objectives from a political and policy level with regards to social protection and inclusion. So the group was set up to build on this, basically, and to also carry out analytical work on these agreed indicators, and also suggest further development and support this sort of policy reviews and benchmarking, etc. And one of the biggest tools that we use all across Europe is, of course, the Survey on Income and Living Conditions, the EU SILC. So this group is more or less the guardian of the EU SILC, and also one of the a strong sort of, that's the most important tool. And this, as everyone knows, is also used nationally all across the Union and elsewhere. Next slide, please. So what does the group do? Well, they develop and define common indicators that measure progress towards the common objectives. So there are 3 strands here. It's social protection and social inclusion, pensions, healthcare, and long-term care. These are, of course, very broad areas, but this is, and it's also very complicated because obviously when you look at the European Union, the countries differ much more than they do in the Nordics. So what we also do is that we participate and create ad hoc groups and task forces together with Eurostat that look into certain specific fields. Recently, we have been looking into pensions in one of the biggest reports that we sort of produced, which is the Pension Adequacy Report. And it goes through all the pension systems all across the European Union. And also this year, we did a similar report on long-term care. Next slide, please. So who's in this group? Well, apart from me and maybe some of the colleagues who are watching, the ISG is composed of national experts in the fields of social inclusion, pension, health, and long-term care from each country and also the European Commission. And the work of the group is supported by the European Commission, mostly from the DG Employment, but also statisticians from Eurostat. And furthermore, we also draw on academic expertise through our studies and work. Next slide, please. So what have we done in last year? Well, actually quite a lot. It's been a very intense year, and we have, of course, monitored the social situation in the EU with relations to the ongoing pandemic. That has been a major task. Furthermore, we have also developed a framework with regards to the new objectives of the European Union. Our leaders of government and state gave us a mandate to set up measurements for poverty and various in what is called the European and Social Rights and its action plan. So this was something that we worked a lot on in order to sort of break it down and create this framework. And we also do benchmarking and monitoring frameworks in other fields. Next slide, please. So this is one of our sort of the most famous indicator that we have. And this is the population at risk of poverty or social exclusion. And this is the indicator that measures this in the EU and also in the Nordic countries that are non-EU members. You can see that Iceland is participating, for example, in here. And this is where we have the European poverty and social exclusion target connected to this. So this is one of the key indicators that we have. And I've also marked here, of course, the Nordic countries so that you can see where we all are. Next slide, please. So ideas to consider. Well, I firmly believe that the Nordic region is underutilized in social policy research. I think that there are many sort of cases for us to sort of build upon that we actually more or less have very, very much in common. And this can actually be used much, much more in order for us to learn more and also to sort of have a better knowledge of what works and what doesn't, etc. And I also believe that the Nordic countries could spearhead development of more and better comparable statistics and indicators. And as Tom just recently showed us, there is quite a lot that we can do, and there is probably a lot of sort of low-hanging fruit where we can sort of pull together and actually make a contribution together. And this new work could, of course, be very inspirational in other forums, such as the EU or the OECD or the United Nations frameworks, where we could together show what we as the regional club can do. And this would also, of course, create better possibilities for further statistical development within these organizations and also enhance our common mutual learning capacities amongst ourselves. But to summarize, we could also sort of be inspirational and show good examples to others. I think that is one of the key things to take with us. So all of this considered, I mean, there are lots of things where we can sort of connect what we do in this group with other groups. So that sort of next slide, please. So thank you very much. That's my sort of introductory presentation. So now we move quickly over to Ulla, who will now present her very interesting work on developing Nordic indicators. Ulla, the floor is yours.
Okay, thank you very much, Christopher. I'll see if I can share my PowerPoint. This is the first test. Let's see.
Works very well.
It works well until now. I'll see if I can.
Presentational mode.
Yeah, is this okay?
Excellent. Look,
Okay.
very nice.
Thank you very much. Well, My name is Ulla Egerskov. I'm working in the Nordic Council of Ministers Secretariat as a senior advisor working with the statistics and analysis. And one of the things I'll just go briefly through this is that I'm involved in managing and developing the Nordic Statistics Database, which actually have a lot of interesting statistics, amongst other things in the social integration and income area in the right bottom down there. And we also have the new Nordic indicators for our Vision 2030 and other interesting statistics. And I also want to put it in another perspective where I've highlighted some of the areas, and it is, as you can see, I've put Vision 2030 on the top now, because this is what we are working around basically, and we have other very interesting statistics. You heard of some of them until now, also indicators on children and young people, gender equality. We have a very fine tailor-made integration and migration statistics made by the Norwegian Statistical Agency. We have the social and welfare statistics presented in the database also from UNESCO, of course. And we have culture statistics, regional statistics, not so much, but that's of course being published by Nordic. We have a little bit of Nordic mobility statistics, and then we of course also would like to have a full set of welfare, Nordic welfare indicators, but we are leaning upon the framework that was developed under the Icelandic chairmanship for some years ago. But the organization around the Nordic Statistics Database is it's managed by a company in Stockholm, Statistiken, who also works from the Swedish Statistical Agency, SCB, and then we have the statistical agencies, UNESCO and the Nordic Council of Ministers represented in the referent group around this. But what I'll focus on now is the Vision 2030 indicators, a little bit on children, young people, and gender.
Unfortunately, we seem to have lost Ulla. So maybe we can see if she can reconnect. Do we have anyone from the technical staff who can sort of try to reconnect with Ulla in some way? Well, dear colleagues and attendees, we don't seem to have the gods of technology with us today, which is unfortunate, but this is something that, of course, happens from time to time. I'm not sure what happened to Ulla, but she doesn't not seem to be with us in this meeting any longer. So maybe the prudent way to proceed is to ask if Mats is with us.
Yes, hello, Christopher. Thank you. I'm with you.
Okay, Mats, let's do like this. Whilst we wait for Ulla to reconnect, we will jump over to your presentation, and then we will get back to Ulla later on. So,
okay, let's do that. Yeah. So thank you. And let's hope that the technology gods will be on my side. Okay, can you see the presentation that I'm currently sharing?
Very well. Looks all good to me.
Great. And is it full screen at the moment?
Not really. It's in some sort of. You could probably put it into the sort. You see 2 slides. You see the next slide as well.
Display settings.
Yes.
In the-
Just a second. Display.
Display settings in top of the screen.
Just a second. Wait a second. What if I go here? Okay. There was something blocking my view, but now you should see the full screen. Is it so?
Yes.
Yes.
Okay,
Very
perfect.
well.
Thank you. Okay, yeah, thanks. So I will now give a sneak preview to one of our ongoing studies where we are focusing on studying indicators to follow up on active and healthy aging and welfare technology for older citizens in the Nordic region. So this is a study which is commissioned by Nordic Welfare Centre. And it's part of Nordic Welfare Centre's Active and Healthy Aging in the Nordic region program, where they have had several projects during the last few years connected to the topic of active and healthy aging. And of course, the notion of active and healthy aging that I will be talking quite a bit about now in my presentation is high on the policy agenda in the world, also in the Nordic region, and it refers to basically the notion that, so to provide and maintain conditions for enabling good health and well-being and social participation as people age. So this is really the background to our study, you could say. We are conducting 2 projects in parallel. This indicator study is the one that I will be focusing on mainly now in my presentation. Then we have another closely related study which is being conducted in parallel, where we will be using these indicators that we are compiling in this project to then examine active and healthy aging from a diverse and intersectional perspective. So basically, we want to understand how is the Nordic senior population faring when it comes to active and healthy aging. But now I will primarily focus on the indicator study in my presentation here today. And of course, just a few words about the background, why this is a topic of relevance in the Nordic region right now. Of course, we know that population aging is one of the major demographic trends that we have, and consequently, this ambition or the notion of promoting active and healthy aging and dealing with aging in general as a challenge, but also as a opportunity, you could say, is something that is high on the policy agenda in the Nordic region. And of course, this means that there is a need for different types of indicators to support these types of policies. And of course, this is something that, of course, is relevant at different policy making levels. So that means that in our project, we are considering indicators at different territorial scales. Of course, in our study, we are a Nordic Research Institute, Nordregio, and we are interested in looking at indicators that allow Nordic comparisons. So this is really the one of the main focus points in our study. What types of indicators are available that allow Nordic comparisons? We are focusing on 3 main questions in our study. Firstly, we have conducted a mapping of what types of relevant indicators for active and healthy aging and welfare technology for seniors currently are available in the Nordic region. The second one is to connect this to policy making. So how are these indicators currently being used to follow up on policy initiatives? Also considering what are the main advantages and also what challenges we are still encountering. And then in the end, our project aims to provide some suggestions for what types of improvement needs there are, and some suggestions for how these indicators could be be improved to better support policymaking at different levels of decision making. So to start off with, just briefly addressing the first question, what types of indicators currently exist? So we have looked at indicators and data from different institutions at the international level, European level, Nordic, national, regional, and municipality level. So these different territorial levels are in the center of our study. And you could say that there are three main domains that we have looked at. Active and healthy aging is the main one, which is in the very center of focus. But of course, also the WHO has the Network for Age-Friendly Cities and Communities, where there are approximately 50 Nordic cities that are part of that network. And there is, of course, a lot of policy action being taken in Nordic cities to make them more age-friendly. And also the third domain is welfare technology, which is, of course, something that could be a way of providing or supporting independence and activity of older citizens in the Nordic region. And of course, then why is this relevant? Well, I mentioned already before that, this is something that has become a responsibility at all decision-making levels, you could say. So our ambition has then been to provide a comprehensive overview of what types of indicators are available at different territorial levels. And of course, part of the mapping is also about what is available, but also what is not available for us then to be able to discuss what improvement needs there currently are. What you see here is not a fully comprehensive list. We have rather long tables. We will have those in our report, but here is just to pinpoint some of the main institutions that provide relevant indicators and data at different territorial levels. Of course, we have these supranational organizations, international OECD, the World Health Organization, the Institute for Health Metrics and Evaluation are three examples worth naming. European level as well is very relevant in our case, also when examining the Nordic region and Nordic municipalities, for example. UNESE, Eurostat, European Social Survey. And we've already heard today, NSOSCO, Nordic Statistics Database, those have been mentioned and are also examples that we have looked at. And of course, then when we are looking at the different Nordic countries, there are two main ones. Firstly, the National Statistics Institutes, and then in addition to that, these various national health agencies, for example, THL in Finland, Socialstyrelsen in Sweden, and so forth. And I mentioned the regional and municipality level, which we are also interested in. And they're basically either data from supranational organizations. For example, Eurostat can be exists at these different NUTS levels. So it allows some, it allows comparisons between regions within the Nordics. And then, of course, most importantly, then these national data from either the National Statistics Institutes or these various national agencies, which are relevant in our case. Some considerations concerning these. Of course, an advantage of these, when we are interested in Nordic comparisons, an advantage of data from, for example, WHO, OECD, Eurostat, is that the data is comparable across countries. So there is no, the question of harmonization has already been taken care of. But of course, then we see that these indicators are not always available for all countries and for the same years, which then is problematic from a comparison perspective. Also, all of our data can be, the ones that we have looked at, the main criteria has been that it can be disaggregated according to age, which is perhaps, or it is the most important when we're talking about addressing older age groups, but it's also very relevant to be able to disaggregate data according to, for example, gender, and maybe different demographic and socioeconomic characteristics, which is possible in some cases, but not in all cases. And then, yes, of course, national data is very relevant in the national context, but then there are cases that we have encountered where it requires quite a bit of harmonization if you want to compare these. So it's not always comparable across countries. And then, of course, even though these supranational institutions, they provide data that can be aggregate or that allows regional comparisons. For example, Eurostat has their own NUTS territorial classification, but they do not always correspond to the political division in the different countries, which can be a bit problematic. But then, of course, then to briefly say a few words about the second question and how these indicators are used to support policy action. We have examined the local level here primarily, been interested in how Nordic municipalities, how they use indicators to follow up on aging policies and what are the main advantages and challenges. Well, we've encountered that the municipalities that we have examined, they do not use indicators that widely in their work yet. It has been difficult to streamline those with the strategies and policies that they may have. And of course, one reflection here is also that most of the data is produced at either the national level or by supranational institutions. And these policymakers at the local level see that they are not always that useful in their case. And they would need, for example, for data to be more that it would allow them, for example, to look at individual differences within the very diverse senior population in their municipalities. So, of course, specifically many of the larger municipalities may have resources to produce their own data, which they do. But of course, smaller municipalities may lack these resources. So for them, it's really a challenge. How could they then be able to use these types of indicators to better support their policy actions? And then to conclude with a few general reflections. Of course, when we're talking about these indicators, I think that they serve many purposes. They can support aging policies in several ways. For example, by allowing the stakeholders to form a common understanding of what are the key dimensions, what should be emphasized in the policies, also setting up goals and objectives, and then also to follow up on progress and monitoring change over time, as in parallel with interventions then being implemented. And maybe just to conclude with what I sort of started up with, saying that it's now that, for example, active and healthy aging has become a responsibility at different policy-making levels, we see that there is indeed a need for relevant indicators on multiple territorial scales. And having indicators that better allow us to address the individual level and the data that can be disaggregated according to different socio-demographic markers such as age and gender is something that could be considered very important. And then finally, something that, of course, at national level is very widely available, but perhaps specifically something that was highlighted by municipalities at local level is that they would also need more subjective indicators that allows self-assessment and touching on how to better grasp the diverse senior populations in their municipalities. Okay, so I think I've used up my 10 minutes approximately right now. I would like to thank you for the opportunity to present here today. This is a work still in progress, and the report will be published in April, and we will have a launch webinar where the two parallel studies that we are conducting now in parallel will be launched. So you can tune into Nordregio's and Nordic Welfare Centre's social media channels and perhaps then tune in when the event will take place closer to them. In April next year. Okay, so thank you very much from my side.
Thank you very much, Mats. This is very fascinating indeed. Just to let you know that we do have a problem with reconnecting to Ulla. So her material will be sent out to all participants electronically, since we have not been able to reconnect with her. And that is, of course, unfortunate. With this, I'd just like to ask you, Mats, do you see sort of any low-hanging fruit from your perspective on where we can sort of work together and what we should do next? Do you have any sort of ideas about this?
Yeah, I think low-hanging fruit, I mean, that's something that we would need to identify, because we as a Nordic Research Institute, we encounter so many of these challenges, not just in relation to the aging data, but statistics in general. The challenge of harmonizing data, countries having different data disclosure methods. So I think that there should just, the producers of the data should be brought to a round table, and we should come to a common agreement. And really, I think that there is cooperation and discussions are taking place, but I think it's, yes, I think that there are good preconditions. We have sort of similar types of structures, similar types of national statistics institutes, similar types of systems. So I think that if there are, I mean, the Nordic region should be the place. I'm not saying that it's easy, but we should be at least the ones who are most well suited to find a common ground here. Yeah, unfortunately, I can't come to think of any low-hanging fruits right now, but I think that I think that all stakeholders, they should be brought together so that we then collectively could identify these. Thanks.
Thank you very much. And Tom, your presentation was really fascinating. I was wondering if you have any experiences very shortly to draw from all of this. I know that you have been working in Nomesco and Ososco with this work for a very long time. And what has happened in order for you to make all this progress in quite a little amount of time?
Thank you, Christopher. Well, as you know, it was the Icelandic foremanship that introduced and started the first Novi project, and that was a long time ago. It was the aftermath of the financial crisis, and there was a report and there was a system produced to be used within the Nordic cooperation. And that didn't happen. And we have many wondered why. But I think the obvious reason is that we now endure a crisis again. And you need to follow a crisis. And already the first report on the Nordic welfare indicators in 2016 said that we need to use timely data, monthly, quarterly data, to be able to do a good job on this. But nothing happened, or very little happened, and there was a lot of hesitation, and there was a lot of discussions that made things go very slowly and even come to a stop. But the pandemic now has changed that a lot. Many more people see that we need to do this, and there is speed under our feet now.
Well, that is very good news that we are actually making progress and sort of pushing ahead as far as I see it. And it's very inspirational, all of the work that has been presented to us in this session. And I think that, as I tried to emphasize in my own presentation, we can use this in other forums as good examples on how to, with limited resources, but with good ideas and good infrastructure when it comes to statistics and statistics production, show others the way forward. And now I believe that we have Ulla with us. Ulla, we had some difficulties and we lost you, unfortunately, but maybe it's possible for you to send out the presentation, because I do believe it was very fascinating, but unfortunately we lost you on during your presentation.
But you actually saw some of it, I hope.
Yes, we did.
I just completed it entirely, and then my computer just crashed. So, and I was just thinking, oh, didn't you see anything at all? But you did.
Yeah.
Well, enough to be very interested in it. So please, let's sort of distribute it freely amongst all the attendees and participants, if possible. That would be very good indeed.
Yes.
Well, dear colleagues and friends and attendances and everyone, I believe we have now reached the end of today, of this session, I mean. I would like to thank the Nordic Welfare Centre for inviting us and for doing so. And then also, of course, the Nordic Council of Ministers and our Finnish hosts. So thank you very much. And a big thank you to the technical staff who've been working very hard with this session indeed. It's been a challenge, but we've done the best we could. And then also thank you to you, the attendees who've been listening in to our discussions. It's been a pleasure. Please stay safe, healthy, and take care. And thank you very much. And I now leave over the word back to Jens. Jens, ole hyvä.
Kiitos. Thank you. Tack, Christopher Lundberg. It's time for a short break. We will continue with the last session in 14 minutes, 12:15 Eastern European time zone. See you again in 14 minutes.